We have a studio full of people here we'll be talking to in just a few minutes.
Yes, that's
All
true.
right, so we'll get everybody all geared up here, make sure everybody's microphones work. Dr. Shahari, how are you?
Good.
Good. You've been on the radio before?
A long time ago.
Oh, with professionals, though.
Mm-hmm.
Yes, I hope so. Yeah.
Welcome.
Dr. Srihari, the professor, this is my old job, Department of Psychiatry, Yale University, and director of the Program for Specialized Treatment in Early Psychosis, known as STEP. That's a lot.
Thank you for being here. You realize
Yes.
you're in a radio station and you're a professor of psychiatry. You may have a pretty busy day here.
Perfect place for you.
I don't think so. I think I'm in good company, but my services won't be necessary.
That's true.
That's kind. Also, Sarah Gadsby from River Valley Services, the Chief Executive Officer there, the Connecticut Department of Mental Health and Addiction Services. Welcome, Sarah.
Thank you for having me.
And
Sarah?
Chief of Police of Middletown, Eric Costa.
Thank you. Hello.
Chief Costa, how are you?
Very good.
Nice to meet you. Have you been on the radio before?
Nothing like this.
Nothing like this. There's nothing like this.
Yeah, there's
In
nothing
a good
like
way and
this,
a bad
but-
way, yeah. You were blown out by the car dealership downstairs.
How can you not love cars? and
Yeah.
Being a police officer.
You saw the NASCAR cars hanging from the ceiling.
Yes.
Yeah.
We kind of see that on the highways every day, too, so
Yeah.
it feels like I'm in a race.
Oh, you got that right.
You see cars in the air, do you get the urge to pull them over and say, how fast are you going up there, pal?
Well,
Yeah.
sometimes you understand the horsepower on some of these cars.
That's true. We have somewhat of
Beautiful.
a car museum out in the other part of the building. Did you see that?
I have not.
The 55 Thunderbird.
Oh, great.
A couple of old cars out there. You'll have it. Toyota of Wallingford is a place of many things.
I think I'll get lost around here.
You're going to find that true.
We'll show you the classic cars on your way out before you leave.
There you go. We're going to play some music, come back, and talk to our guests a little bit about
Excellent.
Mindmap
Yes.
and what that's all about, and about how you can recognize psychosis, especially in younger people. Mm-hmm. Find out what to do about that, hopefully ahead of time,
And how
before it
these
becomes
three
an
people,
impact.
how these three people are working together to make that happen.
That's true. Steely Dan now, Wow Radio CT. Paul McCartney and Wings on Wow Radio CT on this Friday morning, the 22nd day of November. Did I get that correct, Pam Landry?
Yes.
All right, good.
Well done. A+.
Yeah, it's been a long week. Hey, we've got some guests here, Pam Landry.
We have some great guests here today. It all has to do with Mindmap, which is a community collaboration to connect youth with early psychosis care.
You've been running those commercials here
We've
for a
been
while.
running, service announcements for the Mindmap folks for quite a while. And they were kind enough to put the three of you together for us to come here and talk about the subject at Wow Radio CT.
Just right off the top of my head, I just want to ask this question. Sarah Gadsby is from the River Valley Services, RVS. Sarah, is that your voice in the commercials?
Is that my voice?
Yeah, I hear the commercials.
No, it's not.
It's not your voice,
No.
because you actually have an English accent.
I do.
All right, which is very nice, by the way.
Thank you.
So, Sarah, nice to have you here today. Thanks for being here. Pam, we have...
You caught me drinking.
I just saw you
water, I
drinking.
should say. Water.
Sarah, could you go sniff her water just to make sure that's
That's
okay over there?
I
It's
swear.
water? Okay, good.
We have Dr. Vinod Srihari. Is that close?
That's good. Yeah.
Okay, good. Professor, Department of Psychiatry at Yale University, and also the director of the Program for Specialized Treatment Early in Psychosis, which is known as STEP. And we're going to find out exactly what that is. That's part of what we're doing here. And a chief of police of Middletown, Chief Costa. Eric Costa's here.
Good morning.
Chief Costa, glad you're here.
Thank you. I
Safely,
appreciate that.
keeping everybody under control here. That's a nice thing.
Everybody's behaving.
Yeah. You were here early this morning. Is that a habit of yours?
It is.
It is. Good for you. We
Yeah.
could all learn that habit around here, too. So, altogether, this is called Mindmap, and it's called STEP. Sarah, could you explain what STEP and Mindmap is? Two different things?
Actually, I think the best person to talk about Mindmap would be Dr. Shihira.
Sure, I'm
Dr.
happy to
Scheer.
do that.
Well, very nice. Thank you.
I mean, as Pam mentioned, Mindmap is an early detection campaign to bring people with a recent onset of a schizophrenia spectrum disorder or so-called first episode psychosis to bring them into care as soon as possible. And we're excited to have a partnership with 13 agencies across the state that are ready to receive them into care, one of which is led by Sarah, River Valley Services, And so that's what we're trying to do across Connecticut.
Is this part of the state of Connecticut? Is this a state-funded project, or is it privately funded by the organizations?
It's publicly funded by the
Okay.
Department of Mental Health and Addiction Services and the Department of Children and Families and some additional federal support. So this is a public, academic, private collaboration across the state, but the private part being the private nonprofit agencies that are
Sure.
also receiving these individuals.
How long has it been around?
Well, the first Mindmap campaign ran from 2015 to 2019 in the greater New Haven area. And this was a campaign funded by the National Institutes of Health. And we were able to test an approach that was able to reduce delays to care. So this is the time from the onset of the illness to the beginning of treatment, which averaged about 10 months before we started the campaign. And over 4 years, we were able to drop that to 5 months. So that was Mindmap 1.0, so to speak. And sort of buoyed by the results of that study, we're now scaling this across Connecticut and using the lessons learned from that campaign to cover all 169 towns of the state.
Have you been involved with it since the beginning?
I have. So I wrote the grant for the
This
first
is your
Mindmap.
baby. This is your baby. Then.
This is, I'd say, with many others who've been part of this family over the last many, many years. Yeah.
So you started this back in 2015.
Yes.
And you've cut the delay time, you said, from 8 months down to 5 months.
From 10 to 5 months,
5
in
months.
10 towns around New Haven. That's where we first started testing the campaign.
Why is that so important?
We know that for schizophrenia spectrum disorders, the time from when the illness is first diagnosable, which is when people have their first episode of psychosis, to when they begin treatment, is a time that can include many adverse events. So this is a period when people are at higher risk for suicide, for aggression. They may get involved with the criminal justice system. And we know that shortening that delay can dramatically improve long-term outcomes, can help young people retain relationships, stay in school or college, stay in their jobs. And so shortening the DUP has become an international priority across many healthcare systems. And the Mindmap campaign was the first demonstration in the U.S. that we have a way to actually reduce that delay.
It is funny, as you're saying this, I realize it's important in that time difference, cutting that time difference out, not just for the one person who actually has perhaps the psychosis or schizophrenia, but for every person around that person as well.
That's absolutely true. I think the onset of psychosis presents a kind of a social puzzle, because the person who has the illness may or may not be fully aware that this is an illness. So the people around them are often impacted by the behavior the person might engage in that's troubling, puzzling, sometimes even scary to people around them. And so the shortening of this delay involves including all stakeholders in the community to work together to bring young people into care. And so this really does affect the entire community.
Sure.
It's usually, I'm guessing it's usually the people around the person with the illness that notice it before the person that is ill realizes what's happening. And then getting into how do you get that person into treatment? How do you go to that person and say, I think there's an issue, if they're not recognizing it?
Yes, and this is exactly right. And so the campaign involves the use of a variety of approaches to get the message out to everyone in the community to learn how to recognize the early signs and symptoms and to know then what to do, which is a single call to action, our telephone number, where we are happy to speak to anyone who's interested in helping someone who might be ill get into care.
That's great. Do you think sometimes it just goes for the person who's suffering from a psychosis problem? Do you find that they know at all? I mean, do they have a hint that maybe there's a problem, or do you find a lot of people don't realize it until their friends bring it up, until their friends make the ripple?
I think it's all of that is true for different people. In general, the onset of a psychotic illness can be quite subtle. A young person might withdraw from their friends in school, might lose interest in activities they previously found pleasurable, might even begin to have some mild perceptual disturbances. They're in the shower, they hear a noise, they're not sure if it's a voice. And at that moment, they often are aware that something is wrong. But in many of those cases, what will happen in the future is not necessarily a psychotic illness. It's difficult to tell.
Right, there could be depression, too.
It could be
the
many
way you're
different
describing
things.
it, sure.
And so individuals and their families are understandably not sure where this will go. When a full-blown psychotic episode occurs, that is a time when often the individual may lose an awareness that they are ill, or in fact may have a conviction that the problem is not in them but out there in the world.
Sure.
Someone's following them. So the challenges in engaging young people into care need to involve many different trusted stakeholders to make this journey into care as comfortable as possible and as rapid as possible.
And that would include the help from the organizations you mentioned before. How many organizations in Connecticut?
Yeah, so there are 13 local mental health agencies that together form the public sector backbone for care in Connecticut. And I'm really proud to live in a state where they have all agreed to admit these individuals without regard to their insurance status and to help us then cover every resident in the state who needs care.
I think for a lot of us, this is the first time we're hearing about this particular organization and what you guys do. Sarah Gransby is with us. Did I say that correctly?
Sarah Gadsby.
Gadsby?
Gadsby.
Okay, all right.
River
all right.
Valley Services is one of the agencies of the many in the state.
That's correct.
Right, and you're in Middletown.
Yes.
And Sarah Gadsby, you are the CEO of the River Valley Services in Middletown.
Yes.
What is it? How do you fit into the whole Mindmap structure?
So as a local mental health authority, we serve actual Middlesex County, Lyme, and Old Lyme. So we have about 19 towns that we support. We have traditional outpatient services, but we also have licensed clinical social workers that are embedded into the community. So part of that we'll probably talk about a little later is that we have 2 social workers in our CIT team, which is embedded in the Middletown Police Department.
What is CIT?
Crisis intervention
Okay.
teams. And often individuals that are beginning to experience a first episode of psychosis, as we mentioned before, it could be a family member that notices there's a change. It could be the school system, college. So it wouldn't be unusual that that would be the first call to help somebody get services. They may be very concerned about them. So they may end up calling 911 if there's a different altercation in the house. And that's when we, in addition with the Middletown Police Department, would go out and provide an assessment and then hopefully streamline those individuals into services with River Valley.
Is it always with the police department?
No. We have a mobile response team that's available 7 days a week, 24 hours a day. They also will take calls from family members, friends, anybody that, or an individual themselves that might be struggling with thoughts of self-harm or concerns for their well-being.
Can you walk us through this just for a minute? Because I'm curious. If it's 2 o'clock in the morning,
Yep.
which, a lot of things seem to happen in the overnights, 2 o'clock in the morning, somebody has a problem.
Yep.
Might be contemplating suicide. Their friend may be contemplating suicide. They may be acting different, strange. What's the first step? They call who? 911 if it's acute.
Exactly. 911 if it's acute.
Right.
And then if it's in the Middletown area, the local police department could contact our mobile response team who would be able to go out.
And how did they look when they show up? Is this something that is this a marked vehicle? Is this people in uniform? Who shows up in this mobile response team?
They're social workers wearing everyday clothes.
Okay.
And really there to provide support and resources, and if need be, get somebody to a higher level of care.
And that's 24 hours a day.
24 hours, 7 days
Are
a
you
week.
dealing strictly with young people, or is this any population, any age?
Our population is 18 and above.
Okay.
So it's not unusual, especially for somebody with an episode of first psychosis. That's usually around college age.
How do you know it's not drugs? I mean, is this something that you would deal with somebody who's having an overdose or is having a bad trip?
Are you asking if we get called for those
Yeah, I mean,
circumstances?
how would somebody, a layman, see somebody who might be having a hard time, not know the difference? How would they know the difference?
Well, that's a very good question. I think it would be dependent on the circumstances and the person. I mean, I think if this is the first time they've seen somebody that they know and love presenting with some different change in thoughts and behaviors, I think you would automatically go at times to, is that person using substances?
Yeah,
sure.
But there's many other factors. There could be a family history, so there's a genetic component. PTSD can also prevent, give perceptual differences. There's many things. There's an array of different evaluation processes that would occur to determine what's the cause of the psychosis.
What's the easiest way to get a hold of you? Does Connecticut give you an easy number, a 3-digit number, or is it the whole phone number?
Yes, Connecticut right now is really trying to roll out 988, which is the central point for anybody experiencing a mental health need. Mm-hmm. There's also 211, which can also support individuals looking for resources.
Is that 988 number operational now?
Yes.
It is.
It is, okay. And who qualifies for this help? Anybody who needs
Anybody.
it, or from the beginning?
Anybody that needs
Really?
our care.
And again, this falls under a state payment.
Yes.
Hopefully.
It falls under insurance is not a requirement
I
to
see.
get
That was my question.
our services.
Yeah.
Yes,
Okay,
we would support individuals if they qualify getting health insurance.
I see. Dr. Shawari, we've talked about, seeing some of the signs. What is psychosis, though? What is it we should be looking for? This is, I think, even lay people like us should understand what we're looking at if we deal with this.
Sure. So, psychosis is a syndrome like fever where something is wrong. It's an indication that something is wrong, but it can be caused by many different things. So just like one could get fever because of a pneumonia or a seizure disorder, psychosis is a syndrome that people that is a constellation of changes in experiences and behaviors that include hallucinations. People might hear sounds or voices when no one is talking to them. They might see things. They might come to believe things that aren't based in reality, so-called delusions. They might have very apparent disorganization in the way they speak that suggests that their thinking is not proceeding in a linear way. They may also become very socially withdrawn and lack an interest and appetite for the normal range of activities. So this group of symptoms that manifest in different ways can have many causes, and like you were discussing with Sarah, sometimes it can be caused by a substance, and you stop the substance and it might go away. Mm-hmm. It can be caused by other medical disorders, seizure disorders, infections. But in a young person, in the college age, late teens, early 20s, the onset of a psychotic syndrome often is the beginning of a chronic psychotic illness, which we term as the schizophrenia spectrum disorders. So our campaign is trying to find people with psychosis because that's the earliest reliable way to tell something might be wrong that will require treatment. But often the first step is to do an assessment and evaluation and make sure that we're ruling out other conditions that require different kinds of treatment. And then you're left with something that's a schizophrenia spectrum disorder, and you've arrived early, and you can begin treatment that has a bigger impact in the long run.
Before it gets too out of control.
Right. We know that early treatment improves a variety of outcomes. The risk for relapse, hospitalization, reduces the risk for suicide, and also improves people's ability to return to their lives, back to school, back to work, building relationships, and so on.
One more question. We have to take care of some business. We have a weather forecast we have to do. When you say treatment, is this primarily prescription medication, or is this talk therapy? How does that work?
All of the above. So we
Okay.
have comprehensive care models that include psychotherapies, medications, support for school, employment, education of family members, and Sarah can say more.
I was going to say, back to Sarah Gadsby of the CBS.
Great Gatsby.
That's the,
Very good.
River Valley Services. Do you guys are you overlooking people's, the treatment care?
Yes.
Is that something you would do? Because I know it's frightening sometimes with some people that get treated and then you get a prescription, you're asked to go to talk therapy and nobody shows up, nobody takes the medication.
No, and that's exactly what we do. So we, when somebody comes into care with us, we will evaluate the need for the individual, and based on that, a lot of our programs that we have are multidisciplinary teams. So we would have a psychiatrist that could do the medication management piece. We have therapists. We have peer support specialists, vocational specialists, nurses. We really try to provide an integrated approach. We're treating the whole person from their medical needs to their behavioral health, to their substance use needs.
I'm so glad you guys are here today because the commercials we've been running here for the past month or two have just been the tip of the iceberg. We're just seeing what's behind those commercials. When we come back, we're going to talk to the Chief of Police of Middletown.
Exactly what I was going to say, and find out how Chief Costa is involved in all of this.
All right, now let's take a look at the weather forecast. Pam Landry, Mary Lee has that for us. What's the word?
Wow. Coming back with more about Mindmap. This is fascinating. Dr. Sri Hari, Sarah Gatsby from River Valley Services, and last but not least, the Chief of Police of Middletown, Eric Costa. The Mindmap crew are here. We'll call them that. Dr. Sri Hari, professor of the Department of Psychiatry at Yale University and director of the Program for Specialized Treatment in Early Psychosis, known as STEP. We have Sarah Gatsby from River Valley Services out of Middletown. She's the CEO, and that is part of the Connecticut Department of Mental Health and Addiction Services. And Chief Eric Costa, Chief of Police of Middletown.
Welcome to all of you.
Yeah, and what we haven't really talked about yet, Brian, is how the Chief of Police of Middletown is involved in Mindmap.
Well, we are very fortunate to have a partnership with River Valley Services here in the city of Middletown. We are in a situation where we have two embedded CIT workers that are social workers that work with our police officers and independently respond to calls of service when it comes to mental health and people in crisis.
Are these social workers in the police department? When you say they're embedded, do they actually have offices at headquarters?
They do.
They do?
They have an office within the police department.
Okay.
They're Monday through Friday, a day shift, which is 8 to 4, and an evening shift from 4 to midnight. So they're with us, yes.
Is this the kind of thing where a police officer who may have questions could just go in and sit down and informally talk to somebody about how to handle something?
Absolutely. And also, it's so important that they have that opportunity to speak with each other because the officer learns, and so does the social worker. So how they respond together, they're always in alignment. It's very important.
How each other's jobs are done.
Absolutely. It's a great relationship.
Mm-hmm.
So now, who are you working with one of the organizations? Are you working with Sarah's organization?
We are, River Valley Services.
Okay. Sarah, how does this whole thing come together? Did you have to weave this together? Did you and Chief Costa have to sit down and think, okay, this is what you're going to do, this is what we have to do? Because I can't even imagine the legal implications in this. How long have you been doing this?
So the program is approximately 2 years old. Maybe I think probably my predecessor, Celeste Cremen-Endez, approached the chief and the mayor with the idea of embedding a social worker into the department. And Chief Costa, under his leadership, was very open to the idea. So we set out to embed a social worker and definitely had some ups and downs in the beginning, but the overall impact has been tremendous. So much so that we were able to hire a second shift individual to support people getting connected to services.
Oh, that's fantastic. And this is still under the umbrella of Mindmap?
Yes.
This is all part of that?
Well, it's we're able to support this initiative with CIT in that we're able to, when we identify somebody in the early beginning stages of psychosis, and if they need support, we're able to fast track them into services with us.
Oh, very good. Now, Chief Costa, you've been a police officer for how long?
About 30 years.
30 years?
Yes. I still look good, don't I?
You don't look good.
I appreciate it.
You don't look it. You don't look it, sir. So this is the question then. You were a police officer for a long time before this came along.
Yes.
How has this changed for somebody like you who's been in the force for a long time? How has this changed the way that you operate?
I think much differently. We focus now on a customer service-based approach in the city of Middletown. I think that's where it's changed. For so long, again, entering the career field in the 9/11 era where we don't know who is out to harm us nationally, locally. I think a mindset had set in police departments. And now understanding the mental health crisis that's going on, especially with our young people, it's more of our approach of we're here for the community to provide quick and efficient resources at the initial call of service, which you know as well as I do, most of the time, if not all the time, is your local police department or your state police. So
Sure.
It's about being perfect every time. Are we perfect every time? The answer is no. But this is one of those relationships that we built. And when it was posed to me, it's something that I strongly feel about providing services to those that are in need outside the law enforcement mindset.
How have you seen it day to day with the younger officers versus the people like yourself who have been around for a while?
I think
The younger guys and women who are on the force, I imagine, are adapting it pretty well if they learn it from the beginning.
Well, I think that, when she indicated that there were some stumbling and hurdles, it's something that's new in the mindset of policing, and asking that one more question for our officers. But to have that support of the professional with the officer in response to these mental health crises, it gives them more opportunity for confidence to ask that one more question. Say, this might be something more than a law enforcement necessity. This is somebody that might need that next step or the next opportunity for services.
You know, the question I have too is who decides that? I mean, the dispatcher. You have to go down, drill down a little deeper into the organizational part of this to make sure the dispatchers know what they're dealing with.
I think it comes back down to the investment that the city of Middletown has done, and that's why I'm very thankful for our local government. They gave us the opportunity to have the resources to train our people to better recognize the mental health aspects of our responses, and ask that one more question, and asking for the response of our CIT team to come out and to assess people on the scene to make sure that we're not sending somebody to the emergency room that doesn't need to be sent there.
Right.
A lot of time, the people that we deal with already have providers. It's just reconnecting them to those providers.
Chief Costa from Middletown, are you aware of other police departments around that are doing the same thing that you're doing in Middletown? Because we talked before, the state is, with Mindmap, the state is divided into 5 regions, and there are organizations such as River Valley Services in these different regions that are helping people. Are there other departments of police that are intertwined with those other service places in the other regions that are doing what you're doing?
They are, but every individual police department has their own method of introducing that into their communities. So to say that we're exactly the same, I don't want to broad brush it, but there are definitely police departments that put this at the top of their list for their police officers to respond effectively to their community that they need.
Yeah, good.
Congratulations. I'm just thinking, too, because I think a lot of us worked in situations like this. It's tough to get a government, and a town government or a city government, to fall into line and get on the same page with this. So I realize, Chief Costa, that's been a lot of work probably on your part behind the scenes.
It has. And
for Sarah, for you and the River Valley Services, it takes a lot of PowerPoint demonstrations, a lot of data to present. And congratulations to the people who run Middletown, too, for greenlighting this and helping to start this. Dr. Safari, we just asked about other police departments around Connecticut. What about the country? Is this, I know you're part of Yale. Is this part of Yale, or is this independent from Yale University?
So
the Mindmap I'm talking about.
Yeah, the Mindmap campaign was initially funded as a study by the National Institutes of Health that we ran between 2015 and 2019. And once we had success in some lessons, we are now implementing this across the state, and it's now funded by the Department of Mental Health and Addiction Services and the Department of Children and Families. So it's now a state-funded initiative in collaboration with STEP, which is a clinic at Yale. So it's a public academic collaboration. Yeah.
So this is your baby. How much of your time now is spent on the phone or on a FaceTime talking to other states about how this is put together?
Oh, I see. So there is a lot of interest across the U.S. We were the first state to demonstrate a reduction in delays to care because, as you can hear from Sarah and the chief, changing pathways to care can be quite a challenge. It requires a lot of leadership from multiple stakeholders, and the pathway that they have developed here, amongst others, is particularly inspiring because pathways where the police are involved require a lot of careful coordination to not scare family members. So there is a lot of attention to what we're doing. I think if we succeed in shortening delays across the state, there will be a lot more interest in how we pull this off because there are many ways to fail at this. There are many ways in which pathways to care can be very convoluted. People will be demoralized or not want to come in. But if we succeed, I have no doubt that we will bring even more attention. And yes, there is. And people want to know what we did in New Haven that was successful. We have published our results. It is not a secret. And a lot of it is working with leaders like Sarah and Chief Costa to figure out the operational details of how to make it work.
Sure.
It's not a secret, but it's not easy to do.
No, I was just thinking, what we're talking about here is a very delicate situation in so many different ways, medically, socially, and especially legally when it comes to working with police efforts, that you guys are doing a tremendous job. We just did it personally. So thank you for being here with us today. Any last words you'd like to say, Chief Costa?
No, I'm very thankful for this opportunity to spread the word in that I would just like people to look at police officers as a support in the community and not always as the law enforcer. And it's very important. And this is one of those great examples. And I thank you, Doctor, and Sarah.
Sarah, from River Valley Services.
Yes,
I was going to say RVS.
No, we're just very thankful to be working in collaboration with Yale on this initiative. And, there's several ways that we've been able to operationalize this. And, again, very thankful to the Chief of Police. But at the end of the day, really what this is all about is when somebody gets treatment early, it can totally change the course of their illness, and they can have a very satisfying life. And treatment works, and that's really the message.
And that treatment, I am assuming, is mainly your program, Doctor, which is the STEP program, Specialized Treatment in Early Psychosis.
Actually, I'm happy to say that now we're only one of 21 clinics across the state that provide treatment. And
Great.
So to echo Sarah's point, if anyone's listening in and thinking about someone who might need help, treatment works, and the earlier, the better.
And just one more, anybody can feel this. Chief Costa, I'm thinking about you, but if somebody finds somebody, whether in their family or themselves, who needs help, the first person they should call, the first number they should call is 911.
Yes, if
I
they're
would
acute.
think. If it's
Absolutely. And if not, we have the 988 program that's starting to support them for services as well.
And we have another statewide number, which is the Mindmap number. If it's not an acute emergency, it's 203-200-0140.
And I would imagine that's the number if somebody has questions listening to us today or just needs to scout out some information.
Absolutely. We have lots of information, and you can also make a referral for someone or yourself online if you want to just fill out a form on our website.
And that number can be for someone who is dealing with someone they think has psychosis or the person themselves that thinks they may be suffering from something.
Yes, anyone can call this number.
Okay.
Yeah.
To get the first, I would say that's the first step.
Yes.
If somebody has a question, I got a cousin who came over yesterday and was.
Yes, we get those calls.
Yeah. Do you think? And I imagine sometimes it's not the cousin, it's the person who's calling and putting it to the third person instead. Yeah.
Right.
So, well, thank you very much for being here today. I mean, you just enlightened us quite a bit.
Thank you for having us.
And also the website for Mindmap is mindmap.com, .org. Mindmapct.org.
That's right.
Had it right in front of my face.
There you go.
All the information there on the organization and the regions and everything you need to know. Mindmapct.org.
Middletown Chief of Police, Eric Costa. I'm glad you got a chance to get here. We hope to see you again sometime. We'll ask you some more police-like questions.
Yeah.
I'm here for you.
Yeah.
Whatever you need to hear.
Excellent.
We also found out, can I mention where you were before you were Chief of Police?
Sure.
Middletown, you were a state trooper.
I was.
Oh, boy, I bet you have some stories.
All good.
Yeah.
Very proud of that.
I want to find out more about what's going on out there in the roads. Sarah, I'm sorry I messed your name up the first time. I blame it. I didn't have my glasses on. How's that? Sarah Gadsby from River Valley Services. Thank you. Anytime. You're part of the family now.
Thank you
so
so
anytime
much.
you want to come by and get a message out, feel free. And Dr. Sohari from Yale University, professor of psychiatry over at Yale. Thank you. You're here at a radio station once again, so...
Thank you for having me.
The bad news is you're all part of the family now.
Feel free to talk to anybody on the way out for a 50-minute hour. So thank you very much for being here. We appreciate it.
A pleasure meeting you all, and thank you for sharing the info.
Thank you.
It's 11:23 here at Wow.